Today, we're going to be talking about vertigo. As this was the next on the tier of different voted conditions. Excuse me, I got a little bit of a throat thing going on today, so I've been using my my evolution all day. So what we're looking at with vertigo is that vertigo is kind of more of a symptom rather than a condition itself. And it's the sensation that the environment around you or that you are moving or spinning. Now, this can get really troublesome for people who are trying to get on with their day and just trying to even just lead a normal life. Vertigo can come around for a wide variety of reasons, and usually it's connected to a condition, as I mentioned before. We do see a lot of vertigo in people with COVID or post-COVID or long haulers, whatever you want to call it. So vertigo is something that is really prevalent. And when we look to solutions for vertigo, we have to think a little bit differently than one might expect. So the first treatment, hi everyone, the first treatment to vertigo that we will be looking at is actually stimulation of the tongue. So this involves the tongue stimulator, which I have here. And this little guy, really, really thin, that you can put directly on your tongue in your mouth and run electricity into your mouth, which seems like a scary concept for a lot of people, but I swear it's totally safe. It kind of feels just like a little tingle on your tongue, and you probably won't even need to increase the power in order to feel it. So that's one thing. The other thing we're going to try is vagus nerve. Now, we're going to run through both of these in a little bit, but let's just talk about why tongue stimulation may be the answer to vertigo. So what people are often seeming to deal with is this kind of disjointed brain. Your brain is not, it's doing something wrong. Something is firing wrong in your head. So when we do tongue stimulation, what we're aiming to do is access the cranial nerves in the tongue and send the electricity right to the center of the brain through the pons. So these cranial nerves, the nerves in the tongue connect to the pons in the brain that spreads out to all of the other cranial nerves. So essentially by treating the tongue, you treat the whole brain. Now, the preferred method of treating vertigo is to find the thing that triggers your vertigo. Usually people have a trigger. I had one person that was when they tilt their head back, vertigo came on. So what we would do in that case is we would stimulate the tongue, so with the tongue stimulator in their mouth, and then they would try to trigger the vertigo. You want the brain to be being stimulated at the time that the condition would be triggered. That way the brain is kind of engaging, everything is firing, but then it sort of will recognize the incorrect patterns. So the trigger will trigger these incorrect patterns, the brain will respond, and it will kind of lock it down. So what you would do for this is you would plug your tongue stimulator into your device. Any of our devices will do for this, though the Pinnacle and the Pro Sport have the programmability in them for the perfect frequency. So what you would do is you would turn on your Pinnacle or Pro Sport and you would hit the up arrow until you see AVA right there. Once you've done that, you hit the middle button on AVA, and then you're going to hit the right arrow twice, and it will say FREQ 59.35. So this is your programmable mode. This is where you can change and add any frequency you want. So once we're in here, we're going to hold the up arrow until we get to 199.5 hertz. So as you can see there, it is now 199.5. Now, this is the ideal frequency, and then we would hit the right arrow twice, 3 times, 4 times, until we get to it saying mod off. Now, mod off is meaning that modulation is off. We need to set modulation to on. So we'll hit the up arrow a few times until it says mod 3 to 1. I realize that the backlight is making it a little hard to see here, but it should say mod 3 to 1. There you go. You can see it better now. So with mod 3 to 1 on and 199.5 set, this device is tuned to do the perfect frequency for the tongue. Then with the tongue stimulator plugged in, you simply put it on the tongue, close your mouth, and try and engage the motion. Obviously within safe a safe manner. You don't want to be walking a tightrope or something like that if that's what triggers your vertigo. You can do this treatment without triggering the thing, but it is better if you try and trigger the thing that is causing the problem in the first place. You run that for 20 minutes. Now, I have had people that have found that this has resolved their vertigo in one treatment. I've had other people that have found that this is a way to control their vertigo. In that case, bearing in mind you could do it daily if you need to, but my optimum will be every 3 to 4 days. No need to do it daily unless it is actually what is keeping your life normalized. So that is option number 1. Option number 2, oh, and I should say, for those of you that have evolutions or Genesis units, you simply use 121 hertz in either of the devices for stimulating the tongue. Now, for those of you who are looking at doing vagus nerve treatment, you probably want a Y electrode. Now, this is because the Y electrode makes doing this treatment way easier. If I am trying to go onto my neck with the Y probe, I can do it quite simply. If I'm trying to find the right spot with a device, it's just a little bit more uncomfortable. And then I can't really see the device or control it. So with your Y electrode plugged in, you would then switch your device on and go to 7 to 12 hertz. You're going to feel on your left side of your neck for your carotid artery. So you just want to feel for a pulse. Hopefully you can find one. There, okay. Once you've found it, you're going to go a little bit back to about here, and then you're going to put the Y probe right there. And you can see that the balls are stacked on top of each other. They're sitting there. Now, once you've done that, you're going to go to 7 to 12 if you haven't already, and hold the plus button down until you can feel a tingle. You should feel a gentle tingle and a flicker on the neck. So once you get that flicker engaged, you know that you're in the right spot. You can treat this for 3 minutes up to 4 times per day. Now, it is my belief that vagus nerve stimulation needs to be done consistently if you want to receive the full benefits from it. So while one session of vagus nerve can make you feel amazing, it may not work on resolving the root. If you have had a problem for a long time, you need to kind of walk it back. So in order to do that, make sure that you're doing this a couple of times a day and stick to your pattern. Don't give up on it. Just keep going with it. You want to train that vagus nerve. And bearing in mind that the vagus nerve also connects to the brain and all the other cranial nerves. So what we're essentially doing here, however you look at it, is we are treating the cranial nerves in the body. Once we treat the cranial nerves, we can help to reprogram the brain and deal with whatever misfires it has that are going on. Okay, so perfect. So that is today's 10-minute Monday training. We will be doing another one of these next week. So if you found this video helpful, if this is a topic you've been searching for a while, or if you found other things that you found that have worked for vertigo, I would love to hear about them. Please drop the comments in the video description and leave us a like here on Facebook. It bumps the video up the page, lets everyone else see it and see what's going on and get help from it. I think that this is one of the key things I hear about from things like long haulers is this vertigo. I see someone here as well asking a question I'll just address really quickly. Will these treatments address the wonky smell and taste mutations for long haulers? Typically, the tongue stimulation is something that I have seen actually reverse these smell and taste problems. So it's definitely worth doing. It's the kind of treatment that just seems to work. It's something that we want to continue to do. And usually I'm seeing like resolution of that in 1 or 2 treatments. So well worth getting your hands on it and giving it a go if you haven't already, because I can imagine the smell and taste mutations are causing a lot of irritation for people, if nothing else, while also just making life a little bit harder. So, okay, thank you all again. Really appreciate it. Take care, and I'll see you soon.